Belacan nubun miut ublum tikit lugu takwa utang yu nuban na yu akak to 16 takwa tamang milukta Arviat lodi nunubu iluani ublum tikit lugu takwa 56 nuban na yu akak to amatakwa katilukta Arviat mangat pigarapta malikta yu nubar yu akangi mangata 5,339 Amatakwa 643 huli malikta yunuvan na yakangi mata. Amatakwa 189 nunavut miut nuvan na yakalautut nuvan na yakarunnertut. Ikpa katimati luta takwa hiburirti lukta ama Prime Minister takayauti ku katimalawapta dan Prime Minister would okalaw matak dan anya nuvan na yakta nangit to kaput Moderna. Angyak tau himalak pat Canada iluan itakwa nunuvun miut 75% in nakuting unamak tumi tikitit sinamata utaraw tigiligo takwa inui hitamo na pata pingahut kapiyaw yuluang oman tamang milukta nunuvun kapiyaw atakoma kihanit tikika patakwa namak tumi 75% nunuvun miut innang nut tikit suma amatana Moderna tana numan na yung atari ko kaput kawin mayugutan nunubo miyo na machato manunubo iluan ni atok taon niya dahil napakata na mangimat nigdidanak tumit ato kaya kang man kihanita na Moderna huli angyak tao himang ito Canada me angyak tao pat matay mo lak pa kayo tau to kotu takwa January February March milita tamong nunuvud iluan tikijumaman kawahung naunelak tilugutan na adjung ito nunuvud miut kawahung nakang namata saan na kawi mayung ayong nakiyuna nakakatigigwa hukapta katingawa hukapta kihaniman na yo takwa nakakatiging iluta takwa iglumyo Pati kihimitai kanira iluti ublal dua tangiluta kanigi luang iluta telefon tikut ubalu bakal kakatau yakut ublaluk taluta dan mahan na atok tigo tau tokok dengan akago kuwe hung naulek kanak patakwa pekkohe tokabuta tek untuk mangapta tamap talukta nalat cara kakapta takwa anya tailiti chikut malik tau koyangin takwa agawo ang may chata lawit kanigi luak tangin luta ublal luak tangin luta kinapak himatal luta kanigi ila ungahik tiging ni ayokopta takwa maling ikuptigo taan nanuban na 19 nokay lang ikuptigo tayo mo kay naktakama taan inung mataw hami inup kan na makihan ni awla tamat ama nunavud miu nokay na mago ama nunavud miu nokay yulo amago Arviat man nakihimi nunuban na yakamat Arviat Tana malit siya lang labot. Anit tayo ko yung anit tayo lilutit. Matay ko nalat siya to Arviat ni mat na himat siya mak pagka kau yung mga maayong nakit yung maman na tana pagkuhiya bot kihani tana nuvan na yuan nuvu ilo ni halagi naktabot. Good morning. Today Nunavut has 16 new cases of COVID-19 and they're all in Arviat. Nunavut now has a total of 56 active cases of COVID-19. The total number of persons followed to date is 5,339. There are 648 persons currently being followed, and 189 Nunavut have now recovered from the virus. At yesterday's First Minister's meeting, the Prime Minister assured me that Nunavut would get enough of the Moderna vaccine to vaccinate 75% of Nunavut's population over the age of 18. I am hopeful this will happen in the first quarter of 2021. We know Moderna, the vaccine that will work across our remote locations, still needs approval. In the meantime, we are working hard to develop our rollout plan and the logistics and the human resources necessary to administer the vaccine. As we get closer to the holidays, I want Nunavut to really understand what this season will look like. We need to prepare for a very different Christmas season. This means limited gathering and parties. This year, we need to celebrate virtually by phone or with distance, window, and porch visits. We need to stay apart this holiday so we have a chance to come together next Christmas. As always, please do your part. Nunavut, especially in those in Arviat, please don't take any chances. As long as we have people not following the measures, we will see cases rise. It is up to you to stop the spread of COVID-19, and I'd like everyone to have a safe, enjoyable, restful weekend. Thank you.
Good morning. This week, the federal government announced approval of Pfizer's COVID-19 vaccine. As previously mentioned, the Pfizer vaccine storage and transport requirements, such as cold chain storage requirement of -80 Celsius and its sensitivity to transport, do not make it an appropriate choice for Nunavut. Nunavut is waiting for approval of the Moderna vaccine. Once approved, the delivery of this vaccine can begin. And as the Premier mentioned, we expect that in the first 3 months of 2021, Nunavut will receive enough doses to vaccinate 75% of adults living in the territory. The delivery of the vaccine will take into account the unique realities of our territory while ensuring that highest risk individuals such as residents and caregivers in long-term care and elders centers, for example, are given priority when it comes to vaccine distribution. The details of delivery will depend on the timing of deliveries. These priorities are consistent with national recommendations on who should be considered highest priority for vaccination. After the high priority groups have received the vaccine, we will make it available to all Nunavut who are 18 and older, but to be clear, the exact timing of this will depend on the rate and timing of delivery to Nunavut.
Ulla sakku tampani pinasakos ang miga pamatuhak ko nalunar sila ang atangyak daw si maninganitaan na Pfizer nuvatjam ng 19 mo kaputi. Dahil mauhak si magatataan na Pfizer kaputi uyok. Tukok daw si magahak ni nga ulak daw si magahak ni nga tanga sulo nilinak tumingin na lo ni -80 mi. Tanalo ulak daw ga ulugan ng nga nutaan na naman na jangit to Nunavut mo. Nunavut mo takiyuking ulak pa mangyak daw ga ng nga na ay pang Moderna vaccine kaputi unarak toyok. Ang daw si malakatan na kaputaw hatta kalalak to. Niritugu takkini pingasuni sivulak pangin ni 2021 mi. Nunavut mi tako na matuni kapi hatta unalang at 75% in innang ni tamani Nunavut mi ni. Tana kaputi hatta lekatan na sumasaksiyo tayo hatta lang tajiging ito ni sakyo man guta hatta tamani Nunavut mi tamakko sumagilugi ulugan at tuminak pan solo tamakko. Ang ikahaktiyo yun, ipigusutiyo yun luin na kuvinni. So, luta ko, sivuliyo jaw niya ito tamak ko kapiyaw hata palyalala kata. Tako, iluling nga kano, kapiyaw hata lang mga ta, nalunat taw lang ito, hangak ko mga. Tako, sivuliyo jaw lang ito, ukiulit 65 niyo nga tanulo. Tamak ko, ang ikahaktiyo yun, inak kuvinni. Ikanayak ting itamak ko pijit sirak patut amal tamak ko anaham nang itulagan mo pijit sirak ting. Tamak ko si vulyo jaw gali tay matsay na to kan natami atuli ko jaw si mayo kikut si vulyo jaw ga kamanga ta kapiyaw lakto ni. Tak ko si vulyo jaw ga kata si vulyo jaw ko jaw si mayo kapiyaw si malagi kata ato inakulato Nunavut mi ulimanot 18 ni ukiulin ni ngatanulo. Kasi ito kasi natsaya ko lugo. Hangak ko laki na mga tamak sulinalo na tao na ito Nunavut mi.
On Monday, I talked about the rapid testing program that began at the Winnipeg isolation hubs. Today, I will share another initiative that is underway to help reduce the risk of exposure to COVID-19 while reducing the stress that can be caused by current isolation requirements. The Expedited Medical Travel Isolation Program will allow medical travelers attending certain low-risk appointments in southern Canada to isolate immediately upon arrival and return home usually within 7 days of leaving Nunavut. This program requires the medical traveler to stay at a Government of Nunavut isolation site before and after the appointments, use Government of Nunavut provided transportation for all medical appointments and for travel to and from the airport, not visit locations other than the isolation site, scheduled appointments in the airport, wear appropriate PPE during travel and appointment visits, follow all isolation requirements for the duration of their stay, adhere to the return travel requirements in place at the isolation sites, and participants who do not follow these rules will be removed from the program and will have to complete a full 14 days of isolation before returning home.
Nagkajami ako sa kayo gamata ko akilamiyo ko kayo sakta katak palana lang mata Winnipeg mi tuyo mi vingin ni pigarlo ni pingat sami ulumi ko sa kakamami yung asa ni pigar titaw si mayami taman na sakit taw valakan ni ko nagunuvad jan nak 19 taman na takan ako nak tilugo taman na tuyo mi vingin tuyo inutu anit teli kay nakakamning inut tan na kilamiyo ko ana bilar si mayut Anit teli gutiyo yu pili reak tako anna bilar to tako uluganak tumi ngitunik anna bilar lo tekalo na ni kanatami tako tuyok mi vimu chau tiki gunak to tiki palea ammalo angikakun sigun nalo ti ulu 7 tungani Nunavut minga lau tilugin kiseni uko anna bilar simayut ukuning amaligya kalay gayaktun ini kalau ti Nunavut gavamakkungin nalo nak simayangin ni tuyok mi vinnik Sibong agut kingune agullo takuyaw lok tilugin it salang simayumin ni. Atullo Nunavut gavamakkung itatu inaw titangin ni nunasiutikut upakatalo ni anna bilalo ni anna balonut ubalo ni kangatayo kubimik tuyong mivimullo. Asingin na upakatang ilo ni tatsuma tuyong miviwasyanut amalo anna bilak ninginut in upagakak tangin no asingin nulo amalo hanga tayo kuvim mo tako nung ato ato chay nakatalo di tamak ko nga naman ato ni timi mo sa pumiyaw gutinig awlak palaling mini amalo tako yaw na tilugo tako amalit siya katalo tilo na tito yung mivin ni malit taw gailin ni taw na nilimamin ni malit siya lo nilutan na utik na alat tilugo Awla galing mi tako ningin to yung may vinni malitaw galing ni tako ning at say na malin na ko ni tako ilaw kataw yung tamak ko ning amaling ipata tako ning ani taw gayak to pili kayami kamalo tayo maut pigakan na kakali gayak to at ang to ni ulo ni 14 na ani tayo ligaham ni mga kalawin ng mini.
This is not an opt-in program. Department of Health staff and the Office of the Chief Public Health Officer assess the eligibility of appointments based on treatment and procedure types. Travelers whose appointments are approved for this program will be notified by their health center.
Tananalira ko tawag nang ito kinatuin ng mo. Anahan nang ituloy ko kanayak tingit ang malutat suma anahan nang ituloy ang labing akaw sa kayak to kinakutamak ko ng ilaw katawag ng mga ta takuyaw bit sang malit to gil kanulo inulis ak tawag aham ningit tako ala kayali takuyaw bit sang inangit tawag ng tutat suma takaw ikak tawag kayak to nunalin na bengin ni.
Currently, up to 10 people a week have traveled on this program since it began in November. With case counts rising in the south, it is an effective way to reduce the chance of medical travelers being exposed to COVID-19. Finally, I would like to say matna to the communities of Arviat, Whale Cove, and Rankin Inlet and Savikataaq. This past month has not been easy for the residents of these communities and the Iqaluit region as a whole. While there is still work to be done to break transmission in Arviat, I thank everyone who has cooperated with these public health measures. It is those efforts that will help us get through this. Thank you.
Manoyok tako akuli ukatak to binasa ako si tamatay maawla kay nakasak so sitat sa mga kilabi unaktok ko pigalaw sa mama November mi. Tako amis akong panliangin naktulog ita mga kalunanin uwadyoan naktakat to taman naawla nakatsa akong nakto tamak ko anak bilato sakyabi ako naginuwadyoan nak 19 mo. Kingunlak pa mi ta ko mak naktak nunalingit Arviat tikirajuak kanya sanikilalo. Takku sumay mi ta ko ayom naktukku sumamata takko nunalinito kivallermi lo atangirtukin. Suli atsu tikharalo aktilutas nuqattata hullugu saamaq palleani Arviani. Huyanna meerumayakka tamakko ekayom nahat saarsimayo malit saarsimalluti aannaharnangittulerinamu malittaugalinni. Takko taggaatsuruuti sitä ima tavvaniguutti neaqqavuta ima malinnatsaatuaqutsi. Huyanna me.
Ken Driscoll, APTN National News. Dr. Patterson, you identified some of the groups who will be receiving the vaccine first. People at high risk, first responding medical personnel. I'm wondering about the science behind giving it to an affected community. For example, does it make sense, since so many cases are in Arviat, for you guys to prioritize Arviat when it comes to getting the vaccine?
Ketrusko APTN kuniluta Patterson tanna kaputiulaatu hausaraqataarviu. Uluranaqtumiinnersamu sivulliutitaunneangaassuullu tamakkuninga qanayartinut ubbalaanneaharnangittulernermun. Taimaqauyasartulerinikku nalunaartausimavassuullu tamakkuasaarmarbiusimayussuurlaarviani sivulliutaugiaqaqayarmagaata.
We don't know enough about any of these vaccines to know for sure which ones, if any, will work in the way that's required to intervene in an ongoing outbreak like that.
Qayamangittugumaannaayo sulitamakkunanga ilulingin ninalliaatuutiharnersaugajarmanga noqqartitsiguittauluni saarmapalliajuni.
Some vaccines protect you from the effects of the infection, or the worst effects of the disease. So you get the vaccine, you can still get the infection, but you're much less likely to wind up in hospital or need other treatment like that. Some vaccines provide protection by preventing you from getting the disease at all. And so in that case, those vaccines can be used to break transmission, to stop outbreaks literally in their tracks. And we just don't have information on any of these vaccines yet. That sort of information on these vaccines. We know they protect from hospitalization. If anywhere along the line we get new information that they can be used to break transmission, that would be a game changer for not only for Arviat but for many communities affected by outbreaks. Sorry, Uli.
Yeah. Tamakko ilangi kaputiuyut ilangi pitsuterhatangata sapummiyorunnakhullugi tamakko akipeyausimayusurlu seammarbiutteiligunnarsihullugi taatsumunga kaputikkut ammalu unitteili ila uninginersauqattaqayartu qanuiguti qallinginersauqattaqayartu kapiyausimayut ilangillu taakko kaputi pidjuteqasuulluti searmartitsittailinarmut ima nuvajuarnartuttailigunnat searunnaqayartut tamanna searmapalliananga noqqaartitaullattaarunnartu tamakkunuga kisiani maannaayortu kisiutinin nalunaarsimajohangimma taakko kaputi tamakkuninga saqqeurtaunearmanga kisiani sapummigutaugunnaqianga tamanna unitteiligan ila uninginersauqattarunnanarmu aannaarbimu qanimmaluattailigutaunersaugunnarninginno qauyiyaussimajoq nutaani tukisigutta tamakkuanallea noqqartitsigutaugunnarmanga searmagutaugunnartuni tamanna assijjigutaugunnaqayartu suullu maannauyaarbiani taimaiguteqaqatta kisiani qauyissarpalleajaunginnarninginni
Dr. Patterson, I'm wondering, will people who take the vaccine be able to skip the 14 days in the quarantine hubs in the south if they travel?
Luta Patterson taakko kapijoyumini uhattaliqqata taima hulluni 14 anittailigaqarunniaqayaqqaqallunaani tamaanguuteqpalleatillugi.
No. Not right now, because again, we don't know if the vaccines work to break transmission.
Agga maannauyo agga qauyimanginattataakko saarmapalleatissigunnarnami noqqartitsigunnarmangaatassule.
Emma Tran to the Canadian Press. My questions are for the Premier. Yesterday, Yukon announced its plan to roll out the Moderna vaccine in the new year. this afternoon, NWT is doing the same. When will Nunavut announce its plan to roll out the vaccine?
I'm trying to Canadian press kun lipat sa hosa kalaw bitan na madar datok tawlak palay ngab ni ngani kaputi yo. Khali malawak tilo si khanga tan na Nunavut matun na kulak so review.
Thank you. We're still working on our rollout plan, and we will have all the logistics figured out before the vaccine is here. Tana huli piliraya wutana kaputi anya kang nangito nuban na yami tana kaput Nunavut Lorne tikakatani wutana kano piliraya na kitu kapio kana mangata nandiyan nuli tana huli piliraya.
The Moderna vaccine still needs to be stored at -20. Will we get freezers in Nunavut to store the vaccine? Have you had a conversation with the Prime Minister about how that will work?
Tana go chokho taw sa magahang taw na madar na kaputi -20 mi. Ang iyo kadya kana tamita matumamit sa no kano kamagayaw lamang wakatigilaw kayo.
Yes, the Prime Minister has assured us. First, I'd like to thank him because he has made a commitment that Nunavut and the three territories will have enough vaccine of Moderna to do 75% of their adult population. And yes, we will have the capability to store this properly in all the communities. Thank you. Itana Prime Minister matnawa kaso ikpakaw kalaw matana Moderna anya kang nangito nuwan na yami Nunavut mo matakwa ukir taktut NWT ama Yukon mo dana Moderna mi pigupta takwa 75% takwa inokotibut kapiyo yu lang na mata ama itana -20 mi tokok himaga kamatana nunalukta ta ayung ginyak tokot salawatana.
Tobi utak CBC kunni dan luktamu dorang komat. This is for Patterson, Dr. Patterson. Tema Nunavut mit ikarung ng mute inugyak langung mat nunaring miulo ikarung nutikit kayuk paglutitlo anak ding mulo katimayaktong ng mulo kisani ulum yung ngikaroktok kanoy ma Nunavut kavamangat aksugota kangipat Pfizer tikitin nasung ng mo ikarung miunun. A large chunk of Nunavut lives in Iqaluit, and a lot comes by for medical mainly today. Why isn't Nunavut making any efforts to getting the Pfizer vaccine in Iqaluit?
Because the logistical challenges associated with the Pfizer vaccine make it very impractical for smaller centers. Would take a lot of work to get that done, and it would only benefit one community in Nunavut. Whereas if we put the work into Moderna, and plan and prepare for that, we can ensure that as soon as that's available, it will have benefits to all Nunavut.
Pinakanitan na pangnaw tayo kaswa kaya nga awlak tayo hatta kaya nga taan natso nalwa kaya nga taan na Pfizer kaputi na mana kaya nga matamalo pila kaya nga ula kaya kalwa kaya nga taan na Pivale ko tayo kung nakayaksun niya tayo situang mo nalim mo Nunavut tayo may matakwa Moderna nga amig tayo matukaga kangalak ko takwa Nunavut uli mato yung nakatsaw tayo kudlog ataw tsiko.
Tagvalitakot inuy Nunavut kalunani nunakaktuit uparuni anak virak simayut Pfizer meet kaputik sami kapiyo yun nakayakpat. There are many Nunavut who resides down south and are also in down south for medical. Can the Nunavut get the Pfizer vaccine?
It depends on the jurisdiction they're in, and it's not up to me or to Nunavut. It's being supplied at the provincial territorial level, and would have to be consistent with their policies wherever they are at the moment.
Tana maligya ila dako avituk sama viu dei ko atu inautit sipatatat sa mga kaputi may naminik nalo na sa katakayak to dei ko Nunavut miu tao na nito nalani to na tay may timi kapiyaw ga kakayang mga.
Megan Dooling, Nunatsiaq News. I know you're still working on the rollout plan. Will it, do you know, include a public education campaign about the Moderna vaccine, and what will that look like?
Megan Dooling Nunatsiaq ni kau yung magalawak ng asulipam na utaw wala makanutak ko kaputi sakit na wala lamang ata. Kasi nilin natin siya sa audio milaki at sa Moderna kaputi mitsano ang balok ano ilang alaka.
Yeah, it will. The communications plan will cover what people should expect in terms of side effects, what they should expect in timing, like when they'll be available to get it, how they can access it, and ensuring that they know when to come back for their second dose, all of those things, and we'll answer as many questions as possible in those communications.
Taman na to sakit siya ng upang nautitan na pidyutihan na atuta ko amisu na sa yut kano at tutaw na kakayang mga takapiyaw lutik ang maluhangak ko kayang mga kano kayang mga kamalutudlian ni hangak ko kapiyaw kanira to kakayang mga tamat ko kiw kaswa katakayak tavud apik kutiw niyo sa yut sibok mago to sakit siya katangluta.
And obviously I think it's going to come up a lot here, and we'll be discussing a lot of those details at press conferences as well. And one last thing I forgot to add into Toby's question, and it's really important, if somebody is down south and gets a first dose of a vaccine, they need to plan on getting that second dose probably from there. So if somebody is in another jurisdiction and gets first dose with the Pfizer vaccine and then returns to Nunavut, we won't have it, and we will have to start all over again with the Moderna. If somebody gets Moderna vaccine down south and then returns to Nunavut, and it's more than, I think it's going to be about 35 days later, we would also have to restart. So
Restart
the whole vaccine if it's more than 35 days.
Taman na narunang itapik ko tiyo walangin na katalaga yung kamalo nalo na sa katalaga yung gusto lumaan na tusaktit siya tu katatilo ta na tao king ulapat ho biwapik ko tiyo katakta nga sulo kalo na ni kapiyaw yung hamna akad sulo Pfizer mi pilo ang wap tamitan na tao na ni tudla ni kapiyaw kan nakakayak to tamani pitakadjang ma Pfizer mi tan tudla ni kapiyaw gunang ipatamani pigalak kan nakataka kakayak to taman na Moderna mi pigalak gutawlo ni tan naluli kisa ni Moderna mo kapiyaw yung hamna kan tudla ni tamani kapiyaw gunang kayak to gala uloy 35 tungani yung ito akan.
UConn said yesterday during this announcement that they made that they were aiming for 70% of the adult population to be vaccinated to reach herd immunity. What is Nunavut's specific target to reach herd immunity?
UConn may mamatay pat sa tawaga ham na rato titako 70% tingin o kutingin takapiyaw gaswala na kasugit. Tamat ko ino katigi anna majuti tarum na sa khulugit hanulay no na vomito aga hakkan.
We want to protect as many Nunavummiut as possible, especially in higher risk groups. The 75% figure is really, we know or we believe that we're going to get enough vaccine to vaccinate 75% of adults somewhere in the first quarter of 2021, but if later on we can get more vaccine and carry on and offer it to other people who've now become eligible, we'll continue to offer it.
Amisuna pa ngaswak tunila no novumyo na sa pumigo maniakat na pilok tumita makuning ulakan tumin na sagun tuni. Tayo malito kagakaktugo 75% ngini kapiya huyiluta naman na palay mato 75% innay tayo makapiya gumnak silutik. Tako takit pingaso si vulak pangin ni 2021 mitay ko tayo mato kagakaktugot. Kingunago tako amek ko kakata malo kaputi takan na kung nakuta singin not tayo matuin na tigun na lang biyabutan na kaputi.
Are you confident that 75% of Nunavut will come forward to be vaccinated?
Nalong nila tikay tako 75% ni Nunavut atuin na imao pagutila kalo ang mga takapiyaw gayak to kataluti.
Previous experience and based on previous experience with pandemics like H1N1 in 2009, yes.
Kingunit din niya sa mayat tigo takulugi so lupilo ato mi H1N1 lagitilo ta 2009 mi amis sa kapiyaw kata yung mata itay mataw na lang nito nga amis sa kapiyaw kata kung na gumalangat.
Trevor Wright, Nunavut News. Given how some people jump to conclusions and all of that, what would you say to people who are experiencing side effects of the future vaccine?
Trevor Wright, Nunavut News kun nita ko ilangi ta ko ismami ni akitsit sa uti katangata kanuli kaya ko tigun nakikita mako timimino at tuktaw gutigun nang ningino tamako kaputi.
Every vaccine or most vaccines will have some minor side effects associated with it that are 1 or 2% of people will, or a small percentage of people will get. There will be some very rare side effects, potentially, but we don't know, not having seen all the details on the vaccine, I can't comment on those. But by the time the vaccine's administered, any of those questions will either be available in the communications plan or people have every right to ask their healthcare providers what the side effects are and what to do about them when they're getting their vaccine.
Tako kanutuin na kapiyaw yung hamna tilugo nalo nang ito matimi mo kanutuin na atok na kanew sa tuin nang 1 or 2% nginita mako ilangit timi minyo piungin na tao gunak to galwat kisa nito may kayong ito kisa na ilulingin na kayo mangin na masulita mako kano tako nuta kaputi kano at tuin na haun ng mga ata kisa ni kapiyaw valelak tilugi tayo mata mako kyudjuta kanirun nam naksaw katalak to tamalo to sa matin sinik ko pang nautik ko to sa matut siga katalak mayugo tamalo ana ham nang ituliri ko nun ila kapisiyo no ape sutsa katta ko nalang mayue.
Talking about the low-risk medical travel program, who are patients who are considered low-risk medical travelers?
Tako lo anak tumingin na sa ana bila to kilamiyuk ko ti katta ko nam nakakaw gabigi kikko batamak ko lo anak nit tumin sa tako ya katta kali.
Do you mean the Expedited medical travel isolation program?
Yeah.
It's based on the appointment, the nature of their visits in the south. So typically they're going south for 1 or 2 appointments where they'll be relatively quick and very unlikely to be exposed to COVID-19.
Tanay la kilamiyuk ko ana bila to no uti sakay tit sakat na mo tako yaw gatok to ni at jigi katta jang ito kisuni tako yaw gatok ko ti mga ta kalunani ataw sa mimako ni luni ni saliw taw si maluti kambaluta ko uti sakay na nakaktaw suri pata tay matag ano ba jo na mo sakbiw tay titaw luti tay maawla kay na sa titaw katta ko nakto.
Ken Driscoll, APTN National News. Dr. Patterson, we've asked you this before, and I'm wondering about people who have been sent south for medical treatment due to COVID-19 complications. You've said before that you won't tell us that number unless it's more than 5. I'm wondering, is it more or less than 5 now?
Ken Driscoll, APTN ko niluta Patterson na perisima yakalawa kataan na tamako. Halo na alek titaw si mayo tamako pidyo te kaksutuin o kadyo ng 19 mo akaw gunni o te kaksumaningin not. Ukalaw kami talimaw pa tayo nga talon luni. Ukakon naksibit talimaw lang mga tayo nga talon luni.
It's still less than 5.
Sulit talima ito nga nito.
You put in rapid testing in the Winnipeg travel hub as basically an extra layer of protection. Does it make sense to do that in Arviat as well, considering the amount of infections in Arviat?
Tako kila may yuk ko kaya sa ko tini utikon nakto ni Winnipeg may ukaw sa kalaw kawit. Taman na sa puti jaw kan nakon nakullugo tayo malakay Arviat ni tayo may kung naksingin mata.
It's potentially an option when the circumstances are right, when we have enough and we have capacity to do that. But the nature of the rapid testing, they're not a complete replacement for the PCR testing. So in most of the circumstances, all of the circumstances that we're testing in Arviat, we would still need to send out for a confirmatory test. And we're getting those results usually within 48 hours right now. So, not right now.
Taman na nalira ko tiyon na tuwin na kaya liw kalawa na manaw na kat amalo pilirit sa katsarum na nakatakaw sa akum naktunik. Kasi nita na kilamiyo ko kawya sa kutiyo kingu vigo tagon nangin matat sa mga kawya sa kutilatango yung PCR ng nakaktaw yami. Kasi ni man na yok Arviat ni tayo manalo na tayo kakaulat tayo luti kasi ni katayang asuli. Ang maluman na yung 48 ikakay nagay matal utikong naksikat ta katuak tiluguman na yung na Arviat na kilamiyo yung kawya sa kutiyo sa kaktaw dyan ito.
I'm going to turn to the Canadian press. Will the Canadian military be involved in the distribution of vaccines in Nunavut?
I'm trying to Canadian press kung nitako kanata may unalit sa yakoy kayo kataw na katamako kaputi atoy na walalak kata.
Right now, they're organizing the logistics for Government of Canada and with their involvement with the Public Health Agency of Canada. So they'll certainly be involved with the delivery from in the south to our reception centers in Nunavut. The delivery from there to the communities prior to administration will probably just be done by GN staff. The arrangement of it anyway, whether it'll be through scheduled flights or charters, we haven't figured out yet.
Mana yo tako suli pamataw valle mata kanataw gava makungin ni tako anahan nang itulir yakjo ako timiyo yu kanata milaw kataw lutik kano awla taw na mga lihan taw na ni kanlo na ni manilo Nunavut me amano tako kaputi ato na valle kata kano nunalino taw na mga ta Nunavut gava makungin no kapayaw tuin nam na palayo kisene suli init sa liyo tao si Mayo ko hangata yukod o balo hangata titaw yukod aw lak titaw katalang mga suli how you galivo.
Can you give us an update on how the rapid testing program is going in Winnipeg? How many people have taken a rapid test? Has anyone tested positive for COVID-19?
Tako lumiwak to saktit siya kung nakita ko kilamiyo ko kaya sa kuti Winnipeg mipigyak taw lak tilugit katsi kaya saktaw si mabam malunalo na taw si mayo kakanuban dyan naktulik ko tabuna.
I think in the first either 24 or 48 hours of operations, there was 11 or 12 people who entered into the program, and it's typically going to be 3 tests, and there was 1 individual who's tested positive.
3 tests?
3 tests on day 0, 5, and 14. Or sorry, day 0, the day they start, day 5, and day 12, just before they leave.
Sebula pamita ko kakay 24-48 luani ko kaswak tilugita ko 11-12 luni ta ko nung akaw isa ko tinakaw isa taw lautun pingaswak ti akaw isa taw katara hangata sebula pangani ulungani talimangani 12 ngani lo ta ko akaw isa ko ti katara hatilugi kasi na taw sa mitabo na nalo na taw sa mayo ka tunod jang nak tax mayo mi
Tobi tak CBC kunni tema Arviat inugeksikkan ng mingmat nuvagchuang 19 taktoktud Arviat mi kanwirirun nakpat nunaringin ni ay tokluy kataktay manasang ng mit soklo kawi saktitakon nakpa unukod kikkullu qawisaqunnaaqayarpan. With the new cases that showed up today, it sounds like there's a community transmission going on. What can the community do to prevent this from happening? Can there be patrolmen? And if so, who could take care of that?
Some of that's up to the community, and some of that's up to individual choice and participation. There are, there's concerns that there's some people continuing to visit other people, visit people in houses that aren't their own, moving back and forth. All of those things, those are choices that increase the risk and continue the spread of this infection.
Tako ano nali tayo may gunang mga minamin na naroon sa magunak to. Ato niluin tayo nirwaron at sa to ilaw kataw gumang mga army kayo kataw gumang mga army. Solo pula ka kataw nit sa marilutik ta ilang isuli pula ka katam ningin ito sa nakatangad. Utik ta katak sutilo ta magkotagan. Tayo mainusir mini tayo may luro matuwa ko tayo maulo ka anak tumitit sigo ta mataming asar maktit sigo ng maasimino.
I think, though, it's important to remember that people face pressures and circumstances that we don't fully understand, and providing or developing creative ways to support people in isolation is just as important as some of the enforcement measures that we've talked about.
Pimario vong ilata ko solo kaujok tao kagin nakatara hamningin. Tamakko to kisimat sa akong nakullugi tamakko alo akit suilo ta kano akakiyari ba gunak to ni kayok su tayo gunak to ni anit tayo titaw tilugi imamalit tayo kay kasam niyo sila tago.
If those patrols are to go on, who can they contact to give fines or something?
Inoptita.
Kayo sila karong nagamattaw. Takot kawisak naksikpat kikuno unnaglugun nakayakpat.
There's an enforcement program within the government of Nunavut, and so if there's right within the public health orders, there are professions designated as being involved in and having the authority to lay fines, and if there's going to be any patrolling, it should be those types of people, and that it's not something that I think is necessarily useful, but taking those opportunities for education would be my first choice, and definitely don't want to encourage in any way, shape, or form any kind of vigilantism or rogue contact tracing or that sort of stuff, because that is definitely not helpful.
Tamakko malitaw kay nang mapilaka ang atano na voga ba makungin ni solo tamakko anaham nang itulari ng malitaw gali nalo na sa mata kinakko malitaw kay gunang mga ta kinakko lusang ni kang mga ta malitaw kay gunang ng solo kinaw yang nakilitit siguna ng may tamakko solo ato ti haswingin natigo ato taw nang lutuin na kaham ningin no tambalo tamakko akirak taw lutuin na kaham ningin no kisay ni takko ilin natin sinang may ito kasi matit sinang may sivilyo tit siga sa akata.
Numena. Tapos mga ilagay ako mablugo. Tako akvang may utaw. Akvang may utaw katigo. Nunabong may utaw katigo. Maligiyali tako pingwangong itong makayalong mata. Maliktaw kudlata kalwakap tigot. Amiso akvang may utay. Amiso naksakadlay. Maliktut nahalaktut. Ubdutama takalang matataw. Nahalag na miyong ito kisiyani. Nahalang ito ni. Ani yumayot taong ko. Amiso makayalo ino nakatisi. Ani yumalik kaming ito. Nahalaga sa mo anit tayo liyon. Amiso ito ni okaw sa kaktugot. Nahalang ito ni. You know, I just want to stress to our fellow Nunavut in Arviat that please listen to the request of health and the doctor and the premier. Listen to the rules. Listen to what we're asking, because many more people in Arviat that are listening are also getting tired. They too want to go out. They too want to visit, but they cannot until everybody stops visiting and not wearing masks and breaking the rules. If you would listen for 2 weeks, this could all go away. This is so preventable. Just listen. Naalalaw ritchi. Uglaka katangilaw ritchi. Taima. Anyak to kakatak to amisunig Arviani. Naglingnak si Tia katang mata naalalaw ritchi. Ikpag sa uglalaw ta sa kanuing itcheraw tugalot. Ublumi kanuit to tuin nakayakang mata. Ublumi itiroktik. Kanuit to kaktidlugit. Tam nanak sa tuin nakayakak tait. Taikang nat iglungnut. Ama asingin no iglunut. The people you have visited yesterday, they may have been very healthy. But if they had contacted the virus since then, and you visit them, you will now be in contact with it and bring it to the next house you go to. This is very serious. Please stop visiting. Please stop allowing visitors to your house. You know who you are. If you've been told that you have the virus and that you've tested positive, please stop people in your house from visiting. Please stop people from visiting your house. It's very simple. Ayong nangito na ukaw jaw si magubit nalunek taw si magubit nubagyo ang nekaktutit iglumyo katitidlunit nubagyo ang nekaktumik nalunek taw si magupsi uglakan ngileritsi uglak te kakatang ngileritsi taman na tukisinatsiak tok takalak tut alvermiutay tamatuminga nalangit tunik nalakat nalalawatsi salagayon naktasiw na. Ang inaksakad lang magarong ni aksawang naktunig atok si mayusi akbayang mayusigut sa halagi si mayasi anigok ti si mayasi ayong itusi. Akbayang mayut have endured a lot of pain and a lot of hardship over the years. Some of it a lot harder than what they're going through right now. They overcame all those obstacles. You can overcome this. Unite and fight it together. You have our support. Anyak talaga yigayasitaw, takakatang mata, takalak to narunang ito. Ikayo kumanangot, aksawok ugdutama, unutaman. Your health workers that are there are doing a tremendous job in trying to keep this under control. They are getting tired. So too are many caregivers across this country. Help them by helping yourself. Stop going out. And stop letting people from coming to your house. Wait 2 weeks and this will be done. Uglakakatang ilawatsi, uglaktakakatang ilawatsi. Sanatay ni makuan iyon naktoona. Uwes ugviksiw siya nakto si suli. Uglumi nukkaon na of si tamatuminga. That's all I wanted to say. This is getting very hard for our fellow Nunavut and Arviat mute. Tam no ka umatuin nakawaya nukkagaya kalagaro mataman na anyang ikayok toyo magupsi kay kuno nga okalutin o okaluglusi ikayok toyo nagtiak to si. If you need help and support, please feel free to call our toll-free number, and people on those phones will be more than happy to give the support that you require. Thank you.
Megan Dooling, Nunatsiaq News. I have a question for Dr. Patterson, please. You mentioned in your opening remarks about the Expedited Medical Travel Isolation Program, something about, could you clarify if people have already been doing the reduced isolation in November?
Megan duling nunat sa kunitaan na ko sa kagabi at inaulang nakaksugo kila miyuyuk ko na bilato ni aulat at sakata ng mo sa kahit at sakata ng mo. Pigyak tawag yung simalaka taman na November may pigyak taman eh.
Yeah, that's correct.
Tayo matcha.
Okay, thank you. And in response to Toby's question, you said, not to be too hard on the people of Arviat. There's ways to support people, and they're under pressure that we don't understand. Can you talk a little bit more about those pressures and different ways that people can be supported in Arviat right now?
Ita nila Toby api kutika yang ilagay kan nirligo tamakwa sula via miuna lagay akalang ningino tamalo ikayok tawagun nang nakaksugi tamakwa ni taili tilawid tukisima diksigun nakikisuni tamakuni kayo tiniya to inatahakon ng mga.
I'm not going to be able to provide a complete list, and for some people it is, they're just making poor choices. But for some people, they're struggling with it, in isolation in general. It is a struggle for people because it increases stress on everybody, but that aggravates mental wellness for many of us. It aggravates addictions and the stress. And we know that it can increase frequency of things like intimate partner violence and child abuse. And so there's all of those things that aggravate the situation, reduce people's capacity to stick with isolation. And then there's the need to get food and other supplies that aggravates the stress, and anything we can do to remove the stress and support the people who need to be in isolation will help things as well, in addition to enforcement and all the other measures we've talked about.
Tako kisulata ng mga tanalo na itaw si Manjuniti ila ukakon nang Iqaluit nga kisay ni tamakko ilangit nalagunit siya katangata na minerlo nirwa katangata tayo mga kawimat siya Iqaluit sutik kisay ni tamakko takanakataon ng anila ni taili titaulo ni tamakko pilo at tumiiso mamot ukumay gutagon nangat tamakko alutimi mayo lirutaw si Mayunik sula ngayon naktunoy may alun no tayo mapivali lirutagon nangat ubalo ni ay pakini solo anak tarili kutagon nangat ubalo sosong ni pinarluli kutagon nangat ay mak inusang minita kadyo tayo pilugin kisa ni tamakko malit sa akong nahulugan ni tita ila nganit tayo titaw gahaktud takakatang katataw sumalo na muda ko alo ni kita katakakaksutin ni katakakaksutin tamakko amiso takakutaw lakatagon nangata kasi nakanotuin na kayo natatin ni tayo titaw yun ita mga malitaw kayo ni okakan ni nga gutay matuin na kakong natsa kalawak to gutay maapirit sa katakata.
Thank you.
Thanks everyone. We'll see you on Monday.